From Help to Care, brought to you by Family Health Center of Marshfield. We're so glad to be back for another monthly segment. We've been off for 6 months already, waiting for Marshfield Community Television to get in their new digs, and it's a pretty nice space. I'm joined today by Michelle Meidl, family nurse practitioner at our primary care site here in Marshfield. And I'm wondering, Michelle, if you could give us a little introduction about yourself professionally and tell us a little bit about you personally.
Sure. So, as Eva said, my name is Michelle Meidl. I'm a nurse practitioner at the Family Health Center. I have been in healthcare for over 13 years. I grew up in the area. I grew up in Spencer. I live in Marshfield, so I know the area well. I love providing care for patients. It's important to me to be able to provide patients with the care that they need and deserve, which is something that the Family Health Center allows me to do, which I am very passionate about. I have a family and I enjoy, spending time with them, and I like to hike and kayak, and I also do pictures on the side. I do some photography, so that's enjoyable.
Yeah, very good. Nice to have something a little different from the technological aspects of seeing patients and being able to be creative and enjoying our wonderful state, Wisconsin, and recreation and all of that. So welcome. Well, I'm wondering if you could first start with a little bit about our primary care clinic, who we see, what we offer, where we're located.
Sure. So the Marshfield Family Health Center is located in the old City Hall building. It's across from Pick and Save, and we're located on the 6th floor. We offer care to patients of all ages, whether it's an infant or an elderly adult. We also, involved in that, we give them opportunities for, acute care visits. So whether they're sick or had an injury, we also do chronic care visits. So managing their diabetes and their hypertension. We also offer wellness exams and sports physicals and yearly well child visits. They can also get their lab drawn for all of those visits that's as needed. We do offer a lab service. We eventually will have a pharmacy, hopefully, on our floor that's in the works. And so they'll be able to pick up prescriptions right there on the floor, which is always beneficial. I also offer, female exams and some contraceptive options. So a whole multitude of options.
Good. So, taking advantage of the cough and cold and flu and sniffle season, one thing I wonder if I needed a flu shot, could I come to the clinic for that as well?
Yes. We offer mostly all of childhood immunizations are all an option, and then we do have the COVID influenza immunizations also.
Okay, good. And then secondly, taking advantage of this time of year, it's good to talk about some of those coughs and colds and flu and differences and myths and all of that. And I remember my mom, when I was a kid, don't go outside with your hair wet. And as a teenager, I wanted every last second to sleep and jump in the shower and run out to the school bus. And what does the cold do to us? Does it make us sick? Having wet hair, not having a coat, what happens?
Yeah, so being sick comes from a virus. It doesn't come from the cold. So no, you're not going to get sick if you go outside with your hair wet. You're not going to get sick if you're not wearing your hat or you're not wearing a coat. But by not doing those things, it will make you feel more cold. So if you go outside with your hair wet, you will feel more chilled generally, because your heat's not being held in like it is with a hat or with a coat.
Sure. Well, hopefully my mom's watching and taking note of all of that. So looking at all of that, what is a cold? What is the flu? How do we know the difference?
Sure. So the main difference between a cold and influenza is based on onset and severity. So a cold generally comes on gradually. It's not a severe. So the symptoms each day will progress. So you may start out with a cough, and then the next day you're stuffy or runny eyes or whatever it may be. So every day it gets a little bit worse until it turns the corner and gets better. Where with influenza, which is the respiratory form or an upper respiratory infection, that generally comes on suddenly. Main symptoms of that, you feel, like you got hit by a bus, generally. So the full body aches, the cough. Typically, you're going to have fevers. You're going to have chills. There's going to be fatigue involved, headaches. So symptomatically, they are both different in how we approach them.
Okay. So real fast illness, flu we're thinking about, but that's respiratory flu. But there's other kinds of flu also
Correct.
that gets confused in here too. Can you talk about that?
Yeah. So there's definitely a big difference between whether we have influenza or we have the stomach flu. So typically the stomach flu is a different type of virus than influenza. We don't treat the stomach flu the same way we would treat influenza. Influenza is a respiratory illness where typically the GI flu tends to be more of nausea, vomiting, diarrhea.
Okay. But we say flu all
Correct.
the time for all of it. Gets a little confusing.
It is.
Right. All right. So how do we treat a cold?
Yeah. So treating a cold, generally we use home care. And what that means is you want to take care of the symptoms that you're having at home. And so the typical things that we are going to hear us say is increase your fluid intake. You can do that by increasing water. You can do that by taking in anything that is fluid at room temperature. So chicken broth is a good option. You can use Jell-O. You can use ice cream. Obviously in moderation.
Good excuse to have a lot of ice cream, though.
But typically those are the easier ways of those kids with the sore throats and able to get fluids into them, because it hurts to have anything warm. They're going to want cold things, but it hurts to swallow. So because of that, they tend to be able to eat more of those popsicles and the ice cream and the frozen yogurts and the Jell-O options, and they're more apt to do that to get that fluid in rather than just water.
Okay. I wanted to ask, what if I have high blood pressure and the broth option? What can I do about that?
Yeah, so you can use chicken broth, which is a good option, but you have to be conscientious of the sodium intake on that, especially if you have high blood pressure or any other cardiac illness. That's important. So low sodium option or a homemade chicken broth are going to be better options rather than, a full sodium chicken broth that you buy at the grocery store.
Okay. And what else for a cold?
So besides increasing your fluids, you're also going to want to use a pain reliever of some sort to help reduce those body aches. That goes with influenza too. So influenza and colds are treated very similar for home care. There's not really a difference between the two of them. But you're going to want to use like an ibuprofen, which you could take you can take ibuprofen every 6 to 8 hours for those body aches or sore throat or ear pain from the congestion. You could otherwise take Tylenol for more of the fevers and chills type aspect. Tylenol you can take every 4 to 6 hours. So you can alternate them between the two of them. I would just strongly suggest writing them down so you knew what you took last at what time so we don't overdose.
Sure. And what about the liver and taking these medications? I think there's a lot of confusion. What part is affected and when you should be cautious?
Yeah, so Tylenol is metabolized in the liver, and so people with liver issues, we tend to stick away from Tylenol a little bit more, where ibuprofen or an NSAID, so Aleve, Advil, Naproxen, Excedrin, those are all broken down in the kidneys. So there is a difference in that, and I know people get concerned that they don't want to take Tylenol or ibuprofen or an NSAID of some sort because they're afraid of their liver, but it doesn't affect your liver because it's not metabolized there.
Okay.
So it is a good option for those.
Okay.
I would also suggest using a humidification, especially at bedtime in your room. It's really important to keep everything moist and moving. So normally when we sleep, it settles in the lungs, and because we're not up and moving and talking and eating, where using the humidifier, it keeps everything moist and moving, so it's able to get everything out and moving more frequently throughout the night than just settling and then when you wake up in the morning coughing everything up.
So why do we want that stuff to move and get out of our body?
Yeah.
Why is that important?
So the viruses live in the mucus. So it's very important to get out all of the mucus that you can get out so that we get as much of that virus out of our system. That's why our body produces mucus and snot, essentially, because it's trying to eradicate that virus. So it's important. It is a good thing. I know people get concerned sometimes with coughing up sputum, but it's a good thing. We want to get rid of that. So we don't want to suppress that cough because we don't want to leave all that in the bottom of our lungs in those lobes, because then we are apt to make that turn bacterial and then have more problems.
Okay.
So that's a good piece. The other thing that I would strongly suggest in cold and influenza, using honey is really important. Honey helps coat the throat. So typically when we have cold symptoms, we'll get a sore throat because that mucus isn't meant to be on the lining of our throat. It causes irritation, swelling, and also a cough reflux. So when we use honey, it helps coat the throat, so it reduces that mucus when it runs down touching the lining of the throat. So it reduces the swelling, it reduces the inflammation and the pain, and then it also reduces that cough reflux. So honey overall is a really good option. Of course, if you have diabetes, you have to be cautious with the amount of honey that you take in because of the natural sugars.
Sure.
But it doesn't matter how much dosage of honey you take. So you can take a tablespoon, you could take a teaspoon, whatever you're comfortable taking that helps soothe the throat is really important. So you'll notice if you go to the store to buy cough medicine, a lot of them will have honey as an active ingredient.
Yeah.
But generally, because there's other fluid in there, it thins it out. And because we're thinning that honey out, it doesn't work as well. So again, you don't want to do honey in tea. You can do honey in tea, but you also want to take honey by itself because when we thin it out too much, it doesn't stick to create that barrier.
Okay. I was going to ask. I've heard of honey in hot water and
Yep.
drinking that, but sounds like just the spoon, take it, and
Yep.
that's going to really coat and make a
Yep.
big difference.
And then saltwater rinses are really good for those
Yeah.
sore throats too, those gargles.
Sure.
A little bit of salt and some water gargling it is really a helpful piece too.
So you mentioned a lot of things that we can do at home without coming into the doctor office. Some of the things that our moms did for us when we were little, and seems like they're tried and true and continue to be a way to take care of ourselves when we're sick. How do we know when it's time to come in? What are those warning signs when it warrants a trip?
Sure. So generally that's symptomatic. So if you have been having symptoms for longer than 7 to 10 days, typically we want to see you to make sure that it's not turning bacterial, because if it would turn bacterial, then generally you would need an antibiotic. If it's been under 7 to 10 days and things are starting to turn the corner and starting to improve, generally you don't need to come in. You can do home care things and it should take care of it. Something to remember is, a cough can last anywhere from 14 to 21 days. So we don't base
Wow.
treatment on how long our cough lasts. It's all those other symptoms. So after 7 to 10 days, if all of a sudden your symptoms are getting worse instead of getting better, you're starting now to have fevers and chills where before you didn't have fevers and chills,
Right.
that generally would signify, okay, it's probably turning bacterial. This is something we need to treat with an antibiotic.
So I was going to ask about antibiotics and how, that's something that we seem to get more frequently in the past, and now they're not given as freely. And it sounds like you might end up with 2 trips into the doctor office if you come too soon and they send you away without an antibiotic. More times than not, you probably won't need one, but there may be an opportunity where you would need an antibiotic, and you might think, well, why didn't they give that to me in the beginning? And you've just explained it may not be necessary, but further down the line you get new symptoms or worsening symptoms, time to come back in and be seen.
Yeah, and the key to that is antibiotic resistance. So antibiotics is a very important piece, especially that resistance piece. If we're providing antibiotics too much and too often, especially the same antibiotics to the same person, what happens is they can create resistance. So that means that your body, it no longer works for your body because your body has created a resistance to that antibiotic. So now when you are severely sick and you need antibiotics, and maybe that's one of the only antibiotics that works for the sickness you have, you no longer can use it because it's not going to work for you. So then we have to try to find other antibiotics to switch out with that. And also what comes in play with that is, of course, antibiotic reactions, right? If you have a drug allergy to an antibiotic, we have to find a different antibiotic. But that's part of the reason why antibiotics are held back a little bit more, because it's not bacterial. If it's not bacterial, if it's just a viral cold, antibiotics aren't going to help for that because they only work for bacterial infections. Generally, a virus, your body will eradicate it on its own. It will go away over time and with treatment of those symptoms, where a bacterial infection typically needs those antibiotics to get out of your body because your body can't get rid of it always by itself.
Okay. So what kind of medications can treat a virus then?
So there's not a lot of medications to treat a virus. There is antiviral medication, but generally we only use that in terms of like if you do have influenza, you've been tested positive, and now we have to treat you. So Tamiflu is one of those options. Something that's important about Tamiflu, you have to come in with symptom onset within 48 hours in order to be prescribed Tamiflu. And again, those are those sudden symptoms where it's just the one day you wake up and they're there, compared to gradually increasing. If Tamiflu, the reason it's within 48 hours is because what they claim that it can stop symptoms possibly earlier than it would if it ran its course. So it could slow down symptoms 1 to 2 days, possibly at most, to get me feeling better. But the other side effect to that, or the devil's advocate, is it can also cause symptoms. So Tamiflu can cause some GI symptoms along with all your respiratory symptoms that you're feeling. So when you take it, you could have some nausea, vomiting, diarrhea. Now, of course, not everybody is going to get those symptoms, but it is a common side effect to the medication, so you kind of have to weigh out your risk to benefit on that.
Sure, and sometimes you just don't know till you take the medicine, and then you have your answer.
Right.
So you have to decide what's worse sometimes. Oh my gosh. I wondered if you could talk about fever, because I think that's something, people have different baseline temperature, and fever can mean something different to everyone. And I think it makes a difference in age too, a child versus an adult. And
actually, it doesn't make a difference
okay.
in
Well, very
age.
good.
A fever is considered a fever at 100.4, and that is just generally the fever guidelines. Whether you're an adult or a child, 100.4 is the start of a fever.
Yeah.
So anything 100.4 and above would be considered a fever. 99s aren't considered a fever. Sometimes, the common old saying is a low-grade fever. But not particularly enough to say, oh my gosh, you need an antibiotic because you have bacterial infection. Generally, if you have a bacterial infection, you're going to be seeing those high temperatures. You're going to be above 102 or more.
Wow.
Generally looking at that. So it is important to know the difference of when you actually have a fever and when you don't have a fever.
Sure. Wow. Okay, learned something new today. We're coming up to the holiday season. Everybody's together, congregating, people coming from different parts of the country. Why is the flu worse during that time? We kind of say, well, it's because we're mixing germs from different places, but is there more to it than that?
Yeah, so we get sick more often in the winter because of the cold. So viruses don't like heat, which is why our body produces a fever when we're sick, because it's trying to eradicate that virus from within our body. So because of that, they tend not to be as significant in the summer months or the warmer months, but in the colder months, because that's when they grow better. So yes, being around more people at this time, because holidays are typically more in the cold months, I guess, we're more apt to spread viruses. And part of how we reduce all of that the big thing is hand washing, right? It's super important to wash your hands with soap and water for at least 30 seconds.
Sure.
If you don't have access to soap and water, I would strongly suggest using an alcohol-based hand sanitizer to help kind of kill off more of the viral particles that are on your hands. I would make sure that you're sanitizing your surfaces, super important because viruses tend to live on hard surfaces. So countertops in the bathroom, kitchen countertops, door handles, anything that you're more frequently touching with your hands.
Yeah.
I would also tell you to cover your cough or your sneeze, whether that's using tissue or using the crook of your arm. Those are super important things to reduce the spread of the viral particles.
Sure.
Staying away from people that are sick, less chance to get sick.
Yeah.
If somebody is sick in your house, making sure that you do try to keep as much distance as you can. Obviously, sometimes that's not always an option because we're caring for those people.
Yeah.
But whether you wear a mask and then you wash your hands frequently is really important. I would also suggest that you don't share utensils or cups because it's a good way of also spreading that illness. If somebody is sick in your house, write their name on the cup so that you don't accidentally use it.
Yeah. I was kind of smiling a bit when you talked about when you sneeze, cover, and I remember the videos with the mist of the sneeze and how far it can go, and just imagining those germs and viruses everywhere. So some good advice. Cover your cough, cover your sneeze.
But
keep
also,
it contained.
Yeah, but also another piece is try not to touch your face. Is really important too. Keep your hands away from your mouth and your nose. That's a good way of transmitting it also.
Yeah, very good. Curious about flu shots. Is it too late? When's a good time?
No, now is still a really good time to get your flu shot. Typically, we try to make sure people get their flu shots before Christmas time, essentially. You can still get them in January, but it's less. We don't give as many in January and February time because it's generally active by November, December. The flu is starting to go around.
Yeah.
So flu shots are still good to get. I would suggest getting a flu shot if you haven't. Again, you can get that at the Family Health Center.
Yeah, good. Well, what do you think we haven't covered yet that are, important topics around colds and flu and viruses and bacteria and
Well, one of the big things I think going around right now, concern is whooping cough.
Yeah.
There's been a lot of whooping cough going around. Now, whooping cough is a bacteria. It is not a virus, so it does need to be swabbed and tested as a positive, and then we do give an antibiotic for it. If you do come in contact that you've got notice from a school that there's been a lot of kids out with whooping cough, or you've been in a workplace where there's confirmed cases and you do have the whooping cough, I would suggest, and you're sick, going and getting tested to get treated for that. Something else is, you can get your COVID vaccine along with your flu vaccine. They do have it as a combined immunization now, so you can get both in one, so you don't have to get 2 injections, which everybody always likes.
Yeah.
It's always a good thing.
Sure.
Something else I guess we didn't talk a lot about is sore throats.
Yeah.
So
very good.
Sore throats are really common at this time too, because a lot of that postnasal drainage that's causing irritation to the throat. A lot of people think if they have a sore throat, it's strep throat, and that's a common misconception because more likely you're going to have a sore throat from those cold and virus symptoms than from the strep bacteria. Generally, if we think it's strep throat, you're going to have just a few symptoms, and those include the sore throat, generally a headache. So you can have a body rash, and then a fever are the typical, those are the hallmark signs for strep throat. And if you have a cough or congestion, runny nose, usually 9 times out of 10, it's just a cold. It will not come back as a strep because strep is very distinctive to the symptoms that it has.
Okay. All right. Well, thank you, Michelle. It was really good to hear about colds and flus and antibiotics and antivirals and keeping ourselves healthy. So thank you for coming today. And we're happy to close out our show today from Help to Care, brought to you by Family Health Center of Marshfield. We'll see you again in about a month, and happy holidays.